be at OIS 13 taking place December 1st through 2nd, and you'll be on a panel titled The Future of Anterior Surgical Innovation. And I want to set the stage for what you are going to be talking about there. But before you do that, as part of my homework for this interview, I reached out to one of your top KOLs, and I think she's someone who's been with Bausch & Lomb throughout the various stages, has stuck with you, and that is Dr. Dee Stevenson. Oh. And I said, I'm talking to Anthony Wallace. What do you think about him? And here's what she shared with me. Anthony is a breath of fresh air. He knows his products extremely well. If there's a guy that's going to take Bausch & Lomb Surgical to the next level, it's this guy. And she also wanted me to let you know that she'll be one of the first people to use the Envista Aspire monofocal lens. So what do you think about that? That's a pretty phenomenal statement.
First, I'm super happy to hear she'll be the first one, and I know we've been exchanging emails on that. But I'm extremely humbled when you think about someone like Dee Stevenson and the impact that she has made for literally thousands of patients year after year. To receive a compliment like that from Dee is it's truly humbling, and I certainly, it's undeserving, but it's truly humbling, and I look to somebody like Dee for inspiration in my career. So, it's not all upside all the time. We go through challenges. Sometimes you have setbacks. And you think about people like Dee and their mission and what they do for patients. It keeps me going every day. So I'm extremely humbled by the statement and the comments. And I'm just happy to know Dee and peers like her.
Yep. Well, we know that you were the right person for this panel. So let's talk about your session. And before we do that, maybe kind of do a year in review. I think everyone would say it's been a banner year for Bausch & Lomb across all divisions: surgical, pharma, consumer, vision care. Brent Saunders is certainly living up to his reputation as one of the best deal makers in the space. You earlier mentioned the amount of patients Dee Stevenson has touched with Bausch & Lomb products, and that's about 2 million. And your goal was to double that by 2027. And so there's a lot going on. What should we expect from you on this panel? Maybe give a little teaser, and then you can share more with your audience live.
Yeah, absolutely. So first of all, I'm really looking forward to the panel, and it's not just Bausch & Lomb. I'm looking forward to hearing from my colleagues and peers. We're all in this together. I think I've shared this with you before. We don't compete with each other. Our goal is to help patients see better, to live better, and that includes all companies and what they offer for surgeons and patients and healthcare providers. But what I'm going to specifically talk about is 3 unique technologies. And we had a very busy year at Bausch & Lomb this year. A lot of excitement, a lot of hope, and a lot of energy for surgeons and patients. But we're really fortunate to have a year like this. And we're fortunate to have a leader like Brent Saunders. He has not just a passion for the business, but also for the company, and willing to make those investments to bring better technology to patients. So what I'm going to speak about is things that we're about to launch, and we're launching right now. So the first is Envista Aspire and Envista Aspire Toric. This features novel optics that allow for broader range of vision. It makes a compelling option for patients that interact with digital devices on a daily basis. And surgeons already know the benefits of Envista. So this gives all the benefits of Envista along with that broader depth of focus and the uncompromised distance contrast sensitivity. The second thing I'll talk a little bit about is our new Intelligence upgrades, our new software that builds on the Intelligence platform. And really what this is designed to do is to simplify the complexity in cataract surgery, the time-consuming surgical planning process, avoiding lost data, lost time, and it provides really a seamless end-to-end secure flow of information without the need for multiple documents and folders and carrying things around. And finally, it enables EMR and diagnostic device integration. So you have everything in one place. And we believe this will save a lot of time, a lot of energy, and provide better patient care. Speaking of that, we're going to also talk about Cena. Cena is our new optical biometer and topographer system that's the perfect example of how this all integrates. So with Cena, it captures 9 key measurements for refractive cataract patients in one step. And it's fully integrated with our Intelligent surgical planning software. So we believe this is the right mix of diagnostics and helping surgeons plan for their patients to get better impact, better outcomes, and to do it more efficiently. The last thing I'll share, and maybe I'll cover this or one of my colleagues that'll be there, but on the pharmaceutical side of the business, we recently launched MIEBO. The first and only FDA-approved prescription eye drop that targets tear evaporation, which is a leading cause of dry eye disease. And then finally, we acquired Xiidra from Novartis, really building upon our dry eye portfolio. So it's been an exciting year. We look forward to sharing more details of these launches and events as we get to OIS in San Diego.
Well, thank you, Anthony. We'll see you soon in San Diego and look forward to hearing more about some of the innovations that you're bringing and also maybe what we have to look forward to next year, maybe some hints there. So thank you so much, and we'll look forward to seeing you live on stage.
Thank you, Bindu. It's a true pleasure. I appreciate the opportunity. See you soon.